Hello, welcome back. I'm Dr. Mark, and as we previously talked, we are going to review today some of the prescription drugs that can increase the risk of diabetes mellitus type 2. The purpose of this video is, of course, that you understand the risks that come along from taking these prescription drugs so you can prevent the other risk factors and diminish your risk of diabetes mellitus type 2. So let's review the information.
So we are back trying to keep contained this little blue monster that is diabetes, remembering that the general symbol for diabetes is a blue circle. Today we're going to review which prescription drugs cause diabetes, and this means that a patient that previously did not have diabetes now develops it, or a patient that already had it maybe is having trouble getting the control that previously he or she had. So it's a very important topic. Besides, not many people know that there are some drugs that cause diabetes. In previous videos of specifically the one about what is diabetes, we talked about how the balance between insulin and its friends like incretins and the insulin contrarregulatory hormones like epinephrine, cortisol, resistin, cytokines, among others, glucagon, among others. Both of them need to interact in our body to keep our glucose levels in a healthy level from 70 to 140 milligrams per deciliter. When we have one of the two sides winning, it can be very, very harmful for our health. Of course, if the side in the insulin wins, then we have hypoglycemia. And if we have the other side winning, we have hyperglycemia and, of course, diabetes type 2, diabetes mellitus type 2. So the drugs that, of course, cause or make diabetes more complicated are going to affect this balance through different mechanisms, and we will explain very briefly how each one of the drugs can alter this mechanism. So first of all, which drugs are we talking about? We will review here hormones that cause diabetes, antihypertensives, antipsychotics, and statins. These are the four main groups of drugs that cause this kind of complication. There are a few others, however, once again, these are the four most frequent and the ones that have the highest impact in general. So first of all, let's start with hormones. We have mainly three types of hormones. They all belong to the same family called steroids. The first type of steroid are the corticosteroids. These are drugs or hormones similar to cortisol, the main stress hormone. So of course we've reviewed before that cortisol is naturally a counter-regulatory hormone to insulin. This is the structure of all the steroids. So of course when we take steroids for an inflammatory condition, for an immune condition, we are increasing the risk of presenting diabetes just because we are introducing inside of our body a counter-regulatory hormone. Estrogens and androgens are also counter-regulatory hormones. They are not as powerful, of course, as corticosteroids or as cortisol. However, they do have some effect. In fact, we saw in a previous video that androgens, hyperandrogenemia, that we can find in patients with polycystic ovary syndrome, they often present also with insulin resistance. So of course, if we take androgens or estrogens, we can increase our level of insulin resistance and present or debut with diabetes. I will repeat this at the end of the video. However, most patients will not develop diabetes with these drugs, but especially high-risk patients that have a lot of the other risk factors that we previously mentioned in the video about 7 signs that you'll have diabetes, those patients need to be extra careful because if they have other risk factors, when they take these drugs, they do have a high risk of developing diabetes. Number 2, we have antihypertensives. So here we have two very large groups. First of all, diuretics. They are very widely used, sometimes even considered first-line treatment of hypertension. I will not get into the physiopathology of why these drugs increase insulin resistance. Let's just say that hydrochlorothiazide and chlorothalidone can lead to alterations or a decrease in potassium level in blood, and this can in turn make it difficult for our pancreas to secrete insulin. So when we take these drugs, especially when we find low levels of potassium, we are going to have a harder time managing diabetes, or we have a higher risk of developing diabetes. On the other hand, we have beta blockers. Beta blockers are a group of drugs used to treat hypertension that essentially block some of the receptors for epinephrine. This essentially leads epinephrine to not work over certain organs. And one of the main organs affected by this blockage of epinephrine is the pancreas. So the pancreas will not be able to secrete adequate amounts of insulin, and thus it may lead to increases in blood glucose. Here we have the main examples: propranolol, atenolol, and metoprolol. Even though I am showing all types of beta blockers, so different generations, I won't get into it, but there are some newer ones, more specific, for example, for the heart tissue, like atenolol or metoprolol. Those do not affect glucose levels so importantly, because they focus on blocking beta receptors in the heart. They don't go into the pancreas. However, most of them have at least a mild effect, so we have to consider them. Finally, beta blockers present a second problem for a patient that already has diabetes, and that is the fact that when we are taking beta blockers, we may not recognize we are having a hypoglycemia. That is a very, very severe complication of hypoglycemia treatment, or lowering glucose medications. And it may lead to a delay in the treatment of hypoglycemia, and once again having a more severe complications. So beta blockers and diabetes have a complex relationship, as you may see. Then we have antipsychotics. These are the main, let's say, central nervous system drugs that affect diabetes. However, they are not the only ones. And we have that the newer, quote-unquote, newer antipsychotics, like olanzapine, clozapine, and risperidone, these are called as second or third generation antipsychotics. They have a lot of effects. Of course, over the brain, they are used to treat some of the manifestations of schizophrenia. However, they also increase appetite, so the patients eat a lot more. They usually gain weight. They can also directly affect our adipose tissue, our fatty tissue in the body, and facilitate the production of insulin counter-regulatory hormones, and they have a few other effects. So through various effects in the brain, in the fatty tissue, they can block insulin function and essentially make or induce gait weight in our patients, and also facilitate the appearance of diabetes in such patients. And finally, statins. Statins are the most controversial because, of course, we know when we give statins to our patients to lower the quote-unquote bad cholesterol, also known as LDL cholesterol, we are essentially preventing infarctions, strokes, heart attacks, all those types of very severe complications and pathologies. So statins, just like, for example, antihypertensives and other drugs in each of their niche, but statins are a really life-saving drug. But when we give statins through various mechanisms, interference of mitochondrial function and other things, we can prevent our body to respond appropriately to insulin. Some of the most famous statins: atorvastatin, pravastatin, rosuvastatin, and simvastatin. This is the structure of most statins, like the base from which they all came. And of course, this is once again a very, very important drug. As you may have noticed in this video and in general in this channel, we are not talking about prescription names for these drugs. We will always refer them by the substance, because of course the original drug is just as good as, in most cases, as the generic drug. So and besides, in different countries we have different prescription or commercial names, so we will always address each drug by the generic or by the substance that is having the effect, not by the commercial name. If you want to know which commercial name is in your region, then you can search for it. And so these are the main four drugs that may lead to an increased risk for diabetes. Some final considerations. This doesn't mean that these drugs are contraindicated in a patient with diabetes or with insulin resistance. We just have to be extra careful because, as we said previously, these drugs may save a patient's life. Diuretics, statins can prevent heart attacks, strokes. Antipsychotics, of course, are essential for the treatment of schizophrenia, of severe depression. So these are important drugs. We need to give them to patients. However, we have to be extra careful in a patient with high risk of insulin resistance and thus type 2 diabetes. That is also important. These all are associated with type 2 diabetes, not with type 1 diabetes. Number 2, if you see some of the drugs that you may be taking, do not suspend them. It's not an indication to suspend them, just this risk for diabetes. Talk to your physician. Check if there's another drug that can help you that doesn't have this risk, or you can adjust doses or something else, but never suspend any of the drugs that you are taking without talking with the physician that is checking your case, guiding you through your disease. It's more frequent with other risk factors present. So if a patient, for example, is obese and have a strong family history of diabetes and doesn't exercise, of course, these drugs are going to have a much wider effect or a much more profound effect on glucose control. A patient that is, for example, young, that exercises a lot, that eats very healthy, that has a healthy weight, will probably be okay for most of the time that they take these types of drugs. So, of course, once again, the most important thing here is to identify risk factors and manage those risk factors, not necessarily suspend these drugs. Now, once we are giving these drugs, usually an adjustment to the diabetes drugs can bring back a good control, nice healthy levels of glucose. So it's also not the end of the world. We can manage this increase in glucose and in insulin resistance with other strategies. Of course, here I'm talking about the pharmacological side, but I already said if you start exercising, eat more healthy, these drugs will probably not have a significant effect on your glucose level. And of course, as always, if you have doubts, talk to your physician. He is or she is the person that knows you the most in the disease you are presenting. And of course, it's there to help you, to guide you, and to make sure you are healthy and you have a very good quality of life. I, of course, leave also written here the references where I got the information for this video, in case you want to check them out and learn more about this important topic and go even deeper. But this is where we will stop.
That's it. Thank you very much. And as always, help us change the world. Share the information.